Good afternoon and welcome to this meeting of Hertfordshire County Council's Cabinet. I'm David Williams and I'm the leader of Hertfordshire County Council, and this afternoon I'm joined by Teresa Heritage, the Deputy Leader of the Council and the Executive Member for Children, Young People and Families, Derek Ashley, the Executive Member for Growth, Infrastructure, Planning and the Economy, Phil Bibby, Highways and Environment, Terry Duris, Education, Libraries and Localism, Terry Hone, Community Safety and Waste Management, Tim Hutchins, Public Health and Prevention, Richard Roberts, Adult Care and Health, and Ralph Sangster, Resources and Performance. Colleagues, I just have to say that I am committed to participating in a webinar this afternoon, but a timing change may mean it's necessary for me to leave the meeting and ask the Deputy Leader, Teresa Heritage, to chair the rest of the meeting. Before we start, I want to make the following announcement. Due to the coronavirus pandemic, this meeting is being held electronically in accordance with the relevant regulations. Members of the public are able to view the proceedings live streamed on YouTube and also on demand by following the link that's available on the Council's website. Members of Cabinet are asked to keep their microphones and cameras switched off until called to speak, and to switch their microphones and cameras off once they have finished speaking. To indicate a wish to speak, members should use the chat function. I will ask members to vote for, against, or abstain for each item at the end of the debate, and ask that members indicate their vote using the chat function. I will declare the result after each vote. Officers are in attendance but will keep their cameras and microphones switched off unless called to speak. So the first item on our agenda are the minutes of the last meeting, and I'd ask colleagues to confirm the minutes of the meeting held on the 13th of July 2020 as an accurate record. Can I invite you to say for, against, or abstain in chat? Thank you, colleagues. So those are confirmed as an accurate meeting of the meeting on the 13th of July, and I'll sign the minutes when I next have an opportunity. Second item on the agenda are questions from members of the Council to executive members. There are none. Agenda item number 3 is public petitions. There are none. So before going into the substantive items, I just want to highlight that members are reminded that all equalities implications and equalities impact assessments undertaken in relation to any matter on this agenda must be rigorously considered prior to any decision being reached on that matter. May I also remind colleagues that any pecuniary interests or declarable interests must be declared. Our most recent Cabinet meetings have been preceded by one meeting of a special Cabinet panel, which has considered recommendations to these meetings of Cabinet. I'm very pleased to say that we've been able to re-establish the individual portfolio Cabinet panels held virtually but recorded so that they are available on demand on YouTube or by following the links on the Council's websites. So it's the discussions and the recommendations coming out of those individual Cabinet panel meetings that were held during September that are being considered today as we address the agenda of this meeting. The other thing I want to say just before we go to the substantive items is that the order of the agenda has been changed so that item 11, the update on central government's devolution agenda, can be considered after the first substantive item, agenda item number 4. So let's move to that first item, the Hertfordshire County Council's response to COVID-19. And can I ask Ralph Sangster, the Executive Member for Resources and Performance, to introduce that?
Thank you, Chairman. This report provides an update on the response to the COVID-19 pandemic since the last Cabinet report presented on the 13th of July 2020, and the work that the Hertfordshire County Council is undertaking with partners to address the challenges we are facing. This report is the 6th of a monthly series of reports on the Council's response to COVID-19, and with the recommencement of the Council's regular Cabinet panel process, has been the first report to be considered by the Resources and Performance Cabinet panel prior to it coming to Cabinet. The report updates the national government's and Hertfordshire's response to the pandemic. I would particularly wish to draw the Cabinet's attention to a number of important developments referenced in the report. Since the last Cabinet report, Hertfordshire's local outbreak plan has been established. This sets out how partners will work together to prevent, manage, reduce and suppress COVID-19 outbreaks across the county. The plan has established regular outbreak surveillance reporting to ensure that both preventative and reactive processes are used to reduce the risk of outbreaks and contain outbreaks quickly when necessary. It is worth noting that the intervention in recent outbreaks in discrete locations across the county have been effective in controlling and suppressing the transmission of the virus. Operation Shield formally closed on the 31st of July. Since work began, over 120,000 deliveries of food parcels and household essentials and over 2,500 successful prescription deliveries to those residents in need have been made. This includes over 1,100 parcel deliveries to food banks, district councils and other agencies. To ensure urgent crisis intervention support remains available to residents, the Parallel Sustain programme will continue. This relates to the mobilisation of volunteers and the voluntary sector to support residents in need across Hertfordshire. To ensure the Council has a better understanding of the impact COVID is having on our communities, a monthly COVID-19 impact monitor has been produced to accompany this report and can be found on Appendix A. This outlines key headlines from the dashboard of indicators designed to track the impact of COVID-19 on both the County Council services and the County Council as a whole. To ensure the Council has a clear pathway through the impact of COVID-19, it has set up a Hertfordshire County Council COVID-19 recovery group, established to provide strategic direction and decision-making on key principles for recovery of the County Council's operations. To ensure a smooth and successful return of children to school at the beginning of September, a package of information, advice, support and guidance was sent out to schools at the end of June. The bulk of this activity was undertaken by Hearts for Learning. The information provided was in addition to that provided by the Department of Education and communicated through regular bulletins to the schools and via resources on the Hearts grid for learning. To respond to the challenge of home to school transport, an internal cross-department group was established and has been meeting weekly to manage the implementation of transport provision ready for schools to return in September. To support the additional costs of complying with the social distancing requirements of home to school transport, the Council received two grants, government grants, £150,000 to support learning, planning and consultancy, and £950,000 for the first half of the autumn term to support the provision of additional vehicles. Government has also released a new guidance for directors of public health and care homes to follow to enable the safe return of visitors to see their loved ones in residential and nursing homes. This will require individual risk assessments based on local conditions for infection rates and safe staffing levels, as well as continued adherence to infection prevention control measures. On the 2nd of July, a third tranche of unring-fenced COVID-related funding was announced by central government. The latest announcement was approximately a third of the first two funding packages issued across the sector. The allocation of the council to the council was an additional £6.69 million, which brings the total amount of unring-fenced funding up to £54.57 million. Within the last announcement, further loss of income support was also promised. The method of calculating this support is being finalised, but current working estimates are in the region of an additional £6 to £7 million of further funding being allocated during the autumn period. On the 31st of July, a fourth submission of the Ministry of Housing, Communities and Local Government was made, estimating the total financial impact of the COVID-19 during 2021. The return included total estimated additional costs, loss of income, and undelivered savings of £71.6 million. This is an increase of £7.6 million from the second return submitted in May. If the income support funding, estimated at £6 million, is accurate, this will result in a total net pressure of £11 million to be met by the Council. In conjunction with underspends in non-COVID related budget forecasts, a net £9 million overspend is being reported. The financial monitoring position continues to be reported with a heavy emphasis on the level of uncertainty and volatility across all service areas. In particular, the fragility of the social care marketplace, including key service providers, continues to generate concern. In recent weeks, there's also been a concerning uplift in the number of children's social care cases, with an expectation of further increases as schools returned in September. A risk element is included in the £71.6 million forecast, but this will need close monitoring over the next few months. Central government have indicated in recent announcements that further support will be forthcoming in the autumn budget to alleviate financial pressures growing in the sector. The announcements include a mechanism to spread collection fund deficits over 3 years instead of over the normal preceding financial year. And this has been welcomed by the sector, but this does not provide any additional funding, only some initial relief in the 2021 budget period. The integrated plan process has now begun with the objective of creating a list of options capable of delivering an additional £20 million of headroom in the 2021-22 budget. This will be a challenging target to deliver, but it is seen as necessary due to the level of uncertainty surrounding the Council's finances and the late spending review announcement scheduled for late autumn. Thank you, Chair.
Thank you, Ralph. Of course, that report was prepared and discussed at panel on the 4th of September, and since then there have obviously been some developments both locally and nationally in terms of the pandemic. I'd highlight in particular that the County Council has now submitted its 5th return to the Ministry of Housing, Communities and Local Government in terms of the additional funding that we have, the additional resources that we've allocated to support and address the crisis. And in turn, now arrangements have been established for local authorities to indent for the recovery of lost sales fees and charges as well. And then this meeting is happening immediately after the briefing by the Chief Medical Officer and the Chief Scientific Officer outlining the potential growth in the number of cases and the number of hospital admissions and potentially deaths arising from a second spike of the pandemic. So I think it'd be quite useful if I could just turn to Tim Hutchins, the Executive Member for Public Health, just to provide a little bit of local colour in terms of the focus of our public health teams over the last couple of weeks.
Thank you, Leader. I think following the Chief Medical Officer's statement this morning, I would like to firstly share his concerns and endorse the warning he gave us all of the need to follow good COVID procedures. Although many will say that the message has been complicated over recent weeks, the basic instruction for people to follow still holds good. Regularly wash your hands, maintain social distancing, wear face coverings when in close proximity to other people, in particular if you're indoors. We need people to play their part, look after themselves and of course others. Whilst in Hertfordshire as a whole we haven't seen the same level of growth in infections that have been experienced in some parts of the country since the middle of August, we have seen growing numbers, and that should be a cause of concern for us all. Initially that growth was seen more in younger people, but more recently it's been seen in older age groups too. With the reopening of schools and students returning to university, Concerns amongst many residents will understandably increase. Whilst we cannot cover every base, I would like to reassure people that everything we can do to mitigate the risks is being done. We have in place a first-class advice service. We are adding to that by increasing the amount of infection control staff we have in place to work with the schools. And at this time, I would like to pay a wholesome tribute to our teachers, our support staff, and everyone else who is playing their part in trying to keep our schools safe. And everyone else who is playing their part trying to keep the schools safe. Before moving on, I have one ask of parents in the county. Please keep drumming the COVID secure message into your children, ensuring especially that they understand the need for social distancing in all settings. As a parent myself, I understand that challenge. It's not easy, but I do ask you nonetheless to keep trying. Having said that, we haven't experienced the levels of growth. Having said that, we haven't experienced the levels of growth seen elsewhere. I'm keenly aware that numbers can rise quickly when they start to do so, and like an oil tanker, they take longer to slow down. That having been said, the steps we have been taking to reduce outbreaks have largely been successful. An initial outbreak in Watford, for example, thanks in no small part to the support of community leaders, was quickly suppressed and stabilised. An outbreak in Dacorum that threatened to get out of hand was quickly brought under control using effective local tracing and with the support of the local population. In both cases, we can reasonably state that what we and our colleagues in environmental health put in place works. Both areas' numbers have pretty much returned to what they were in August. Our largest outbreak has been in Hertfordshire. While still of some concern, it is largely stabilised, again in no small part due to the support we have received from community leaders. Whilst Hertfordshire remains on the government's watch list, it is a source of some pride that they didn't impose much stricter measures due on the basis that they were impressed by the robust measures, and I quote, the robust measures we had already put in place. In closing, I would also like to mention testing, which has obviously been an issue in the past week or so. Whilst this is largely the responsibility of central government, we have been doing all we can to get increased capacity in Hertfordshire. I'm pleased to say that in addition to the existing sites, there are now new facilities coming online in Hertfordshire and at the University of Hertfordshire. And as of this week, a new facility for key workers, which by adding our own funding, we have been able to double in size. May I also add with regard to testing, unless you're symptomatic, you should not be asking for a test. And can I say, if you are in contact with people who have been symptomatic, you should be self-isolating for 14 days. And finally, again, I make no apologies for repeating this. We can put into place as many number of measures, but without the full cooperation of the public, they will come to naught. Please, regularly wash your hands, maintain social distancing, wear face coverings when in close proximity to people. If you become infectious, whether you're symptomatic or not, you cannot select who you will or will not protect. If you don't play your part, you will directly or indirectly infect others. In June and July, the people of Hertfordshire played their part and the numbers came down. Most still are, but the virus is still with us. We need everybody to do so. Thank you.
Tim, that's very helpful, and I must at this stage just pay tribute to the work that you've done, and also our Director of Public Health, Jim McManus, in terms of responding to those challenges that we've faced as we've gone through August and September. Richard Roberts, the Executive Member for Adult Social Care and Health, just wanted to come in.
Thank you, Chairman. I pay tribute to my colleague's comprehensive overview of this report, and I will be brief. But I just wanted to take the opportunity to thank our care staff working across a range of care settings, both looking after those with learning disabilities, in supported living, those with physical disabilities, and of course our elderly in care homes and nursing homes, because our staff there, many of whom are working in the private sector with care providers, have now been working their full shift in PPE for 6 months now. This is a huge effort over and above how they would normally work. But as a result, since April, infection in care homes and care settings has been hugely reduced, and until recently we had very, very little outbreak at all. My thanks to them. And in addition, I'd like to thank them for their ability to bring families and those cared for together under quite difficult circumstances. And I hope we can keep that going for as long as possible as infection rates increase. Finally, just from the report, grateful for the work to set up the Hertfordshire Community Health Network, which is the CVS, coming together to really build on the momentum that was initiated as part of Sustain and Shield, and just bringing volunteers together, and that will help cement those relationships that built there. And also the Hertfordshire Economic Recovery Team, which will be the Money Advice Unit and Citizens Advice Bureau, bringing together their collective powers to help support people, possibly post-furlough, when things could be tough within our communities. I think the Money Advice Unit has already, I think it was in our report that went to panel 2 weeks ago, I've already handed out something like 7.5 million, or I've collected on behalf of residents over 7.5 million during the pandemic so far, and that will continue. Thank you very much.
Thanks, Richard. Terry Doris, can you update us on the return to school, home to school transport, and some of the issues in relation to reporting cases in schools?
I think it's fair to say that in terms of reporting some of the cases in schools, there's been a relative lack of clarity from the centre nationally as to who they should be reported to. And working with Jim McManus and Tanya Rule and the rest of the education team, they have gone to great lengths to make it as clear as possible. And there's a new flowchart going out, or an updated flowchart, I believe, going out today on the Hertfordshire Grid for Learning, which is the internal grid for schools, to give them further information on how to report, when to report, and to whom to report. So I think that's very important. In terms of the numbers, I'm very pleased to say that we have a significant number of young people attending school. It's about 98%, I think, at the last figure. And allied to that, it's worth just making reference to the fact that both our education team, our admissions team, our transport team have worked very closely with Environment and Transport within Hertfordshire County Council to ensure that we have had 65, or at least 65, duplicate buses running to make sure that all the children can get to school. And as part of that, we've had over the last 2 weeks 70 spotters, 70 observers out looking at the most troublesome areas in front of the school gates. As a positive outcome of this dreadful situation in terms of the pandemic, I am pleased to report that we have seen an increase in the number of young people walking and cycling to school, and that actually has a very positive effect on their well-being and health. Now, whether or not they are actually cycling or walking the whole distance, or whether the parents are dropping them off half a mile away and avoiding the crush at the school gates, I don't know. But whichever it is, it's good that they are actually walking to school and getting that benefit. The advice from central government, the nuancing of some of the advice from Department for Education does change with some level of speed, and I'm grateful to colleagues in the Education Department, which is a very small section actually within County Hall, for the work that they've done, and they have worked tirelessly 7 days a week in many occasions to provide a service to schools and to support the head teachers and the school staff. On a slightly different aspect within my portfolio, just to mention, and pleasing to mention, that we now have 30 out of 46 of our libraries open for browsing, and I'm very pleased to report that. And we're now looking at working with the remaining 16 libraries to get them open for browsing as soon as is possible.
Terry, thank you. So the Cabinet panel recommended to Cabinet that Cabinet approves the content of the report, including the planned approach to dealing with the financial implications. Can I ask colleagues to vote whether they are for or not in chat, and those responses are coming through. Thank you. So that proposal is supported. So I now want to move on to what was formerly agenda item number 11, but now our second agenda item this afternoon. And that is the report that went to the Resources and Cabinet panel on the update on central government's devolution agenda. And Ralph, can I ask you to introduce this?
Yes, Chair. This report updates the members of the Cabinet panel on the latest developments in respect of the government's devolution agenda. It invites Cabinet panel to note the direction of government policy, the expected content of the forthcoming devolution and local recovery white paper, and the activity that has been undertaken to date to support the County Council's response to those developments. It was acknowledged at my Cabinet panel that until the government's white paper is published, the scope and implications of the local government reform remain to be established. This report and the formal publication of the PwC report on the financial implications of various options for LGR establishes a platform for discussion within the Council and fulfills the undertaking made at the last Council meeting to do so. Thank you, Chair.
Thank you, Ralph. I would just like to just reflect on some of the discussions that have happened since that meeting on the 4th of September, and in particular that leading up to the publication of the white paper, ministers made very clear to local authorities that the devolution white paper would set out transformative plans for economic recovery and renewal, and that the plans would include restructuring local institutions to establish more mayors and more unitary councils. So the whole question of the publication of the white paper is critical to this. We know that this was after the general election in December. It soon became evident that it was the government's plans to introduce the white paper in June. Now, as a result of the pandemic, the decision was taken to delay the introduction, and we were expecting the white paper to be published in the autumn. I have to say there is some speculation that it may not be possible to publish the white paper in the autumn, and inevitably the status of the pandemic and the potential return, the evidence that we're seeing now about a second spike, means that it may be considered challenging for the government to publish this at this time. However, from my own perspective, colleagues will be aware that we did commission PwC to look at the opportunity that existed here. It is a significant opportunity, and if there is to be a reform to establish more unitary councils, something which I support very strongly, then I think we all need to recognise, and government needs to recognise, that if it wants new institutions in place as we go through 2022, 23, 24, then it really is important that the devolution white paper is issued as soon as possible. So we just need to wait and see whether it is possible to bring the white paper forward in the autumn, and particularly whether it can come forward in October. But in the meantime, unless there are any comments from colleagues, I would ask that the proposal that came from the Cabinet panel, which was in the order paper at 11.1, namely that Cabinet would note the latest statements from government in respect of devolution and local government reform, and note the findings of the initial options appraisal conducted in Hertfordshire. Can I ask colleagues to outline in chat whether they are for, against, or abstaining from that proposal?
Derek, I did raise my hand. I don't know whether you saw it or not.
Sorry, I didn't, Derek. I'm more than happy that you come in.
Okay, thank you very much. Now, unfortunately, I did drop out for 5 minutes there, and I do hope everyone can hear my contribution. I'd just like to support the comments you made, Chairman. And basically, I know we're in a bit of a wait and see situation, but I do hope that the white paper comes forward with some radical proposals on local government reorganisation. This is a subject that has remained unfinished business for many, many years. And I think it's high time that government delivered a constitutional settlement for England in particular, which can last the test of time. We do have a unitary structure in all the devolved nations, Scotland, Wales, Northern Ireland, and we do have unitary structures across large areas of England, both in the bigger cities and indeed many rural areas such as Wiltshire, Cornwall and the Isle of Wight. All of these structures seem to be working very satisfactorily. There certainly is no evidence whatsoever that anywhere that has a unitary structure is campaigning to bring back the two-tier system, and indeed quite the reverse. Complementary to implementing a unitary system, which would give you a much more strategic oversight of local government functions, is a strengthening of the lower tier, which people can readily identify with. That is the town councils, the parish councils, community councils, and this would be complementary to the introduction of a single tier system. The public do not understand how the two-tier system works. That's pretty evident every time people ring us up and we knock on doors, and it is incredibly wasteful. In Hertfordshire alone, it's estimated if we went to a unitary structure, we could save up to £100 million. And I do think this is a time where we're under a lot of pressure financially. We should be doing our utmost to deliver efficient local government for the people of Hertfordshire. So I'm hoping that we will see something that comes forward that delivers a simpler structure that people can identify with, and indeed saves huge amounts of public money. So as I say, I support your comments. I know it's wait and see, but I do hope that we finally reach a position where the government introduces a constitutional settlement for England, similar to other areas of the country, which will last the test of time. Thank you, Chairman.
Thank you, Derek, and apologies for missing your hand up when you indicated. Yeah, and just let me reiterate that you mentioned 100 million. That is 100 million a year. So correct. Over 5 years, that's £500 million that could be saved for Hertfordshire's residents. And, you know, I think I just reiterate and underscore what you said, Derek, in terms of other authorities that have gone down this route, other county authorities, not just the metropolitan authorities. And of course, most recently, our neighbours in Buckinghamshire have gone down this route. In all cases, it's very clear that the engagement with individual residents has been transformed as a result of these structures being put in place. So contrary to what some suggest that unitary government means remote government, quite the contrary. Some outstanding examples of new arrangements, new engagement, and new opportunities being established to tease out what are the priorities for individual communities and to act on them. So yes, I share your hope that the government will be able to bring this forward and bring it forward as soon as possible in order that the changes can be made as we go through the rest of this Parliament towards 2024. So thank you, Derek. If I can ask members to indicate whether they support the proposal that was in the order paper at 11.1. Thank you. I think, yes, that's unanimously agreed. Thank you. So we're now going to go back to the agenda item that was formerly agenda item number 5, which is the financial support to care providers during the COVID pandemic. And Richard, you're going to introduce this.
Thank you, Leader. We made a commitment in March, planned for even in February, before the pandemic really took hold, about how we were going to work with and support the care provider market so that our most vulnerable, frail elderly, those with learning disability and physical disability could be supported through the pandemic. And those procedures that we put in place and the funding that has since come from government has served us and residents well. And what this paper seeks to do is to further support the sector through October, November and December, potentially through to March of next year, as a heads up in a sense, because we currently spend, or the sector is currently spending approximately £3 million a month to sustain both the PPE element, the additional staffing, and of course, with lower vacancies in care homes at the moment, actually making sure that care homes and care providers are sustainable for the future and will meet care provision needs. So to that end, we are seeking an additional £14 million. My apologies. We are seeking additional funding, of which the shortfall is £14 million, and that shortfall will be made up by from savings from care vacancies and PPE savings, so that there will be a nil cost to the council. And I recommend this as the way forward. The Director of Adult Social Care is to be given the opportunity to both support the elements of PPE and staffing, but also using really strict criteria to make sure that providers who are get into financial trouble, that we can assess them and support them as necessary. That doesn't mean that every provider that struggles financially will be supported, but where there's a critical need for our residents, then we will do so. So those recommendations are 5, 1, A and B, and I recommend them to Cabinet. Thank you.
Thank you, Richard. And I'm assuming that there was strong support in your Cabinet panel for this.
There was unanimous support, all party support for this panel. Thank you.
Thanks, Richard. Any comments from colleagues? If not, can I put the proposal set out at 5.1 in the order paper? And can you indicate your response in chat? So that is agreed. Thank you, colleagues. Let's move on to agenda item number 6 on the order paper, the approval of the Hertfordshire County Council smoke-free policy and toolkit. Tim Hutchins.
Yeah, thank you, Leader. This came before Cabinet about just over a year ago for an indication as to the level of support, which I was pleased to say was given. We were then asked to go back and consult staff and do some proper research and come back with this paper, which is seeking Cabinet approval to implement a smoke-free policy as of the 1st of January next year. In bringing the paper forward, it is comprehensive, so I'm not going to go into it in great detail, but the motivation behind it was basically in Hertfordshire we put a lot of work into reducing the number of smokers in the county. And thankfully, we're currently running at about 12%, which is some way below national average. But nonetheless, we still have a number of people smoking. and it impacts mainly in terms of health inequalities. So we felt very strongly that it was a necessity for us not only to talk the talk, but actually walk the talk, if I can put it like that, and introduce this policy on our own grounds. So very briefly, looking at the conditions this will apply, smoking will be prohibited across all county council sites, whether owned or leased, and the prohibition will apply also to visitors. As part of the consultation, we obviously looked at other aspects of the policy to ensure that actually it wasn't too draconian, particularly where it affected people in their own homes, which obviously we would want to do. Although if they're on county business and visible to the public, they will still be prohibited from smoking. People in care homes, in day centres, etc., people having mental health treatments. There are a number of issues which need to be taken into account and where exemptions will be given. I think basically, finally, I would just like, as an ex-smoker, I know how difficult this is for a lot of people, but I think with a degree of sensitivity and care, we'll be able to bring this forward. Managers will be encouraged to support people rather than introduce disciplinary proceedings, although of course that option will be available should it be required. So it went to my panel on the 10th of September. It was agreed unanimously, and I would very much seek your approval, colleagues' approval, for the recommendations which are contained within paragraphs 3, small 1 to 4. 4. Thank you.
Tim, thank you for that. Any comments, colleagues? If not, therefore, can I put the proposal that's set out in the order paper and ask if you are for, against, or abstaining? Excellent. So that's agreed. So thank you for that.
Sorry, I meant to say thank you to our staff, and I mean that in the broadest sense. The consultation went to nearly 600 of them, and they all contributed very constructively, and I think that should be acknowledged.
Thanks, Tim. Yes, we will note that. So I'm afraid time is not on my side, and I am going to invite Teresa Heritage to come and chair the rest of the meeting.
Okay, thank you. Thank you, David.
Okay.
Okay, thanks. So, colleagues, we now move to item 7, the adoption of the revised Minerals and Waste Development Scheme. Could I ask Derek to present the report?
Yes, good afternoon. Thank you very much. The Minerals and Waste Development Scheme is a statutory obligation placed upon the County Council in terms of its minerals and waste strategic plans. It lays out a process and timetable whereby we revise these plans. There has been a slight revision to this. This is non-controversial, really, and as I say, it's mainly process. It was presented to the Growth, Infrastructure, Planning and Economy panel on the 8th of September. The panel reviewed the adoption of this revised Minerals and Waste Development Scheme and agreed it should be taken forward through Cabinet to the County Council. And therefore I'm proposing that Cabinet recommends to the County Council approves the revised Minerals and Waste Development Scheme and new timetable as attached at Appendix A and Appendix B to the report. And happy to answer any questions, Chairman.
Thank you, Derek. Colleagues, any comments, please? No, in that case, can we go to the vote, please? All those in favour, for, against, whatever.
Terry, I'll agree, but I couldn't get onto the chat line, so please take...
Yeah, that's right. It's quite difficult, isn't it, once everybody starts voting? Okay, thanks very much, everybody. That's agreed. Thank you very much. We now move on to item 8, the Winter Service Operational Plan. Phil Bibby.
Thank you, Teresa. This is the annual agreement of our Winter Service Operational Plan and a review of last year's activity. It also includes what we are doing for the future. Last year, there were 56 precautionary sorting outings, just above the average. And without our revised policy last year of moving interventions from 1 degree C to 0.5 degrees C, there would have been 11 more outings. We reviewed our inaccessible routes and were able to service a lot more by carrying a crew of 2 instead of 1, one being helping the driver reversing out of tight spots. But COVID prevented us from carrying this on too much, so therefore we've ordered some smaller vehicles to help this winter. There was a large increase in requests for self-help due to better promotion, I'm glad to see. And after delay due to COVID, we are continuing our review of high priority footways and salt bins. My panel unanimously agreed to ask Cabinet to agree to the recommendations at 3.1 in the Cabinet papers.
Thank you very much, Phil. Colleagues, any comments, questions? In that case, we'll move to the vote, please. Thank you. That item has been agreed. Thank you very much. We now move on to item 9, the proposal to alter the way that primary behaviour support services, including intensive short-term schooling provision for pupils at risk of exclusion, are delivered in the borough of Broxbourne. Terry Duras, please.
Thank you, Teresa. Just pulling up. This was considered at the Education, Libraries and Localism panel and agreed unanimously. It provides for a new primary behaviour support base to support mainstream schools and intensive short stay schools. It will require an age range change, which is embodied in the proposals, which are not quite as set out in the Cabinet paper, and I will read them in full, but they are exactly as set out and agreed at the Education, Libraries and Localism panel. We are planning to change and move the provision into an education support centre at the Rivers, which is rated good, and to close the Andrews Lane support centre, which has been actually empty for the last number of months. The Rivers is regarded as good by Ofsted, and we have consulted with the relevant parties, had 20 responses, 17 in favour. There was a question mark presented by the Chair of Governors at Andrews Lane, but I can confidently say that there have been discussions with representatives from Rivers and ourselves, and the Chair of Governors is, I understand, wholly satisfied with the proposals. This will close the Andrews Lane Centre and expand the Rivers, and that will also automatically increase the numbers available to 12. It's set out in the panel papers. The Rivers ESC is already commissioned to undertake outreach support, so there will be no loss of facility for this. And funding will be provided from the SEND provision capital grant, and any underspends will be returned to the capital grant fund. So in broad terms, it makes great sense to undertake this piece of work. We are very grateful to Andrews Lane for their contributions over the years, and we look forward to working with Rivers going forward. So on that basis, the recommendation to Cabinet is that Cabinet authorises the publication of a statutory notice to close the primary support base, PSB, located at Andrews Lane Primary School with effect from January 2021, and conditional upon the outcome of this, agrees the change in the age range of Rivers Educational Support Centre, ESC, and approves the capital funding for the Education Support Centre.
Thank you very much.
Happy to answer any questions.
Yeah, Tim Hutchins.
Yes, thank you, Terry. I just wanted to speak in support of the recommendation, particularly as the Rivers is on my patch and I'm a past trustee of the Rivers. And I just wanted to say, I don't know if people are aware of what goes on in our educational support centres, but they do a really challenging job and they do it really well, and we should be really grateful to the people that work in all of them. Thank you. That's all I wanted to say.
Indeed. Thanks very much, Tim. Thank you for that. Any more questions, comments? There's also a part 2 item on this, which we'll move there later.
No, with respect,
now.
Terry, there isn't. That's the part 2 item is on the next item, the Valley.
Okay, fine. Sorry, thank you. I was getting an incorrect indication there. Thank you. So, colleagues, please may you vote on this one. Thank you. Okay, that's been agreed. Thank you very much indeed. So we now move to item.
Forgive me, Terry, or Teresa. I don't think my vote went through for some reason, but I obviously was for. Yes.
Yeah. Okay, fine. Thank you. Thank you. Item 10 is whether to build the Valley. It's gone now. It's gone through now, Terry. Item 10, whether to rebuild the Valley School in Stevenage, a community special school for children with learning difficulties on its current site. And this is where we also have a part 2 item. So again, Terry Duras, please.
Thank you very much. The paper before you is very slim, but enormously important to those students who currently attend and will in future attend the Valley School in Stevenage. The school is, I'm afraid to say, long past its healthy lifespan. It is being patched up as we speak to continue for a further couple of years. And the decision has been made, or the decision will be made, I hope today, to enable the new school to be built on the site of the existing school, but at the rear of the site. And then obviously the existing buildings will be demolished. The proposal is in fact for the school to accommodate 165 students. Currently there's 153 in the school. 165, it has been suggested, why aren't there more? But all the evidence says that 165 for a school of that size is the optimum number. There is a part 2 item, and the decision on the part 1 is contingent upon our acceptance of and approval of the part 2 item, which relates to the financial arrangements for the school. I don't really think I've got anything to say. There are times in your life when you think, yes, this is a really good news story, and I have to say this is a really good news story. And the great thing about it is that sorry.
No, sorry, we've got sound problems. Don't worry, we're okay. Carry on. Oh.
And the great thing about it is that we believe the earliest we can achieve this, if we crack on now, will be the autumn of 2022, which in reality, 2 years ahead. It's something very much to look forward to.
Thanks, Terry. Thank you. Tim, could I ask you to turn your camera off, please?
Oh, sorry.
It's all right. And Phil Bibby, you wish to speak?
Teresa. The Valley School is not in my division, but it's within the town of Stevenage from where I come. And I agree with Terry, it's a really good news story for the town. That's an old sort of 50s, 60s type school, which is falling down around the pupils' ears. So rebuilding on the existing site is by far the best option. So thanks for Falling Education for deciding this way. Thank you. I support it, obviously.
Thank you very much.
Actually, I should say to Teresa that only part of the building, I believe, is habitable at the present time. So it's not good.
No, indeed. So is anybody else that'd like to speak? Phil, you still have your hand up. Please, could I ask you all to indicate how you vote, please?
Oh, I'm sorry, Teresa. I think we've actually gone ahead of ourselves. My sincere apologies. I don't think we can vote on this until we have been into part 2 and agreed the part 2 recommendation, as I mentioned, that it is contingent upon us agreeing that, and then we will have to come back into part 1 and agree the recommendation.
Okay, thank you very much. Sorry, got my instructions on that one a bit late. So anyway, we've all voted in favour at the moment, but we'll come back to it later once we've been into part 2. Okay, the new chair here, not sure what she's doing.
She's doing 12. Very well.
Item 12, sale of land at Ascot Road, Watford.
Thank you, Terry. This one's mine, I believe.
Yes, it is.
Good. Yeah, this is a site that was acquired when the Metropolitan Line extension was being considered some number of years ago. The site came up for sale, and we purchased it on the basis that it would contribute to the opportunity for MLX to have a station located in Ascot Road. The fact that MLX has somewhat faded away from expectations has left us with the site, which is now surplus to our requirements, in so much as the site was always too big for the proposed station, and we're now thinking of how we can maximise our benefits from the site. The site is located in a sector of Watford which is under significant development by Courthold Developments Limited, who own sites adjoining this one, and it places them in a unique position to offer us an enhanced value for the site, because it provides them with an opportunity of bringing it into their overall scheme and therefore getting additional marriage value from the site. So the proposal is to sell the site to Courtholds on a 250-year lease, and not a freehold, and to have 2 leases, one for the development site itself and one for an additional element of the site, which we will retain the option to reacquire should any extension of the MLX proposals, or any other proposal which would be similar to the provision of MLX, come forward in the next few years. We can then reacquire that site to provide the station and the facilities for that extension to the Metropolitan Line. It includes adding some extra strength foundations to the proposed buildings, so that we can also include a number of car parking spaces, which would be very useful at the station itself. I'm not going to comment on the financial position as reserved for part 2, but happy to cover any comments or questions on the part 1 element.
Okay, thank you, Ralph. Anybody have any questions, queries, comments on this part 1 of this particular item? No? Okay, I can't see anything at the moment. Okay, in that case, I will move to part 2. We're going to move into a closed session to consider exempt business. Once we've done that, we'll come back into part 1 to make the decisions. Thank you. Okay, we're back live now. So colleagues, we're now looking at item 10 again, and the rebuilding of the Valley School. The proposal is that Cabinet approves a capital project to rebuild the Valley School on its current site in Stevenage. Please could you show Okay, thank you. So that item has been agreed, item 10. We're now moving on to the sale of land at Ascot Road, and the proposal is as set out on the agenda. Could I ask you to vote accordingly? Okay, so that has been agreed. Thank you very much. And that completes the business for today. So thank you very much indeed. Thank you.
Thank you, Chair.
Thank you.
Thank you,
Bye-bye.
Chair.
Bye.
Thank you.